Hello, viewers. Good evening and welcome to another exciting section on Mstv GH Health Canna. My name is Hasia Ahmed, and we are going to have a very interesting and an exciting topic today. Today, we are going to talk about sickle cell anemia. Can't wait for you to join me to learn more about sickle cell anemia. We'll take this quick commercial break. When we come back, the journey begins.
I like everybody to pay attention to Mstv. It's the best TV station I've come across right now, and they are good. They are everywhere, anywhere you can find them. Go on Facebook, you see their page, they follow them, and you will like their everyday activities. Thank you very much.
Welcome back, viewers. Today, we want to talk about sickle cell anemia. When we say sickle cell, what do you know? What comes to your mind when we say sickle cell? Sickle cell, it's like it's an hereditary disease which is inherited from our parents, which affects our red blood cells. Every normal human being has very round red blood cells, but those with sickle cell have crenated red cells. Crenated means it's halfway, it's just like half moon. So their red cells in their body is not fully formed, it is half formed. Okay, and this is not a disease, it is an inherited disease. People with sickle cell are mostly called sicklers in our community. Okay, so sickling has got to do with hereditary. We inherit sickle cell from both parents. So when we say somebody has sickle cell, it means the person's red blood cells is not full. It is half. It is crenated. It has a comma shape. So people living with sickle cell who are fully sickled have a lot of disabilities as compared to people who are not sickle cell. What are some of the disabilities? Because their red cells is not round, it's not fully shaped, which their red cells is a comma shape. They have this high affinity for oxygen. Their red cells are not able to absorb enough oxygen for the body to function well. So people living with sickle cell have lower uh, uh, hemoglobin level. They usually have lower hemoglobin level because they don't have enough red cells in their body. How do people get sickle cell? So what happens is that there is another a test we call genotype. Each and every one of us should really go and check and know their genotype. We have different types of genotype. We have people who are AA. We have people who are AS. We have people who are SS. We have people who are AC. We have people who are SC. We have people who are CC. So what happens to the genotype when you are ASAAA? So when you are AA, that means you don't have any sickle cell traits in your body. When you are AA, you don't have any sickle cell traits in your body. When you are AS, that means you are a carrier of sickle cell. Okay. When you are AS, you're a carrier of a sickle cell. When you're SS, you are fully a sickle cell patient. You are fully a sickle cell patient. When you are AC, you're not a sickle cell patient, but your charges on your red cells are negative. When you are SC, you are a sickle cell patient. When you are CC, you have a negative charge on your cells, red blood cells. Okay. So how do we get sickle cell, or how does sickle cell come about? When you have a parent, when one is AS and another one is AS, and when they're trying to give birth to you, there's a possibility of the S from the mother and S from the father crossing to give us SS. That's when you become a fully sickle cell patient. Okay, so we entreat each and every one of us to know their genotype. When you are AS, it's not advisable to go for someone who is AS. And also not advisable to go for someone who is AC, because the C and the S can also cross to give us an SC sickle cell child. To avoid you and your child, your children from getting sickle cell, it's very, very, very important. You should check your genotype, and your man or your woman should also check their genotype. We know the love is there, but the genotype first. Okay, you have to check whether you're a carrier, whether your partner is also a carrier, so that you don't cross and get a sickle cell child. When you are sickle, you are sickler, or you have sickle cell, what happens is that you fall sick a lot. You fall sick a lot. You fall sick a lot, and you can get sickle cell anemia. Most of the sickle cell patients have sickle cell anemia, in which their body is not able to absorb enough oxygen, which make them have a lower hemoglobin level. They have lower HB, in which they develop anemia. So we are trying as much as possible to let you know that your genotype before marriage or before getting a child is very, 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 very important. We'll go for a quick commercial break. When we come back, we'll delve more inside this topic. It's related to sickle cell. Okay, so we've explained what sickle cell is to this point. We also want you to know about what are the symptoms of sickle cell when you realize your child is anemic, has lower HB level. When you also see episodes of pain, the person feels a lot of pain all over their body, you should also suspect, or you should also go and check for the child. When there's a swelling of the hand and the feet, when the person has frequent infections, delay in growth, you see that the child is not growing, it looks like a maggot, he is very smallish, you should also know that the person has sickle cell anemia. When the person has a vision problem, you should also suspect sickle cell anemia. You should go to the hospital to see a doctor, explain all the symptoms that is happening to the child, and let the doctor have a request for a test to be conducted in the laboratory. Which test is conducted in the laboratory is either a blood test on sickling, and the other one is a genotype test, which is also which the blood is also used. Okay. Somebody might ask, do we have sickle cell cure? Yes, we have either a bone marrow transplant or a stem cell transplant, which are quite expensive to deal with. So we would advise each and every one of us to try as much as possible to know their genotype. Know your genotype, know your partner's genotype to avoid getting a sickle cell child in the future. Okay, so we talked about what sickle cell is, how sickle cell came about, how it is inherited, what happens to the child, the signs, the symptoms, the prevention. The prevention is you checking your genotype, knowing your partner's genotype, the possible cure or treatment of sickle cell. This is where we'll draw the curtains on what sickle cell is. Catch us same time next week on Mstv. Follow us on all our social media platforms. And thank you to my crew. I'm glad to be working with you. Mstv. My name is Hasi Ahmed.